indicator of kidney disease. Often it may be asymptomatic, the swelling of the legs. Don't ignore this. These stones can be silent and keep damaging the kidney.
After brainstem death is declared, one
Yes.
can donate.
Yes.
I remember you telling me once that, Salman Khan's creatinine could be quite different from another individual of the same age who's quite lean, who doesn't have so much muscle mass.
So all the hospitals in the city, including the hospital where this donor was, refused to accept the kidney.
Hello and welcome to a new episode of my podcast. I'm Aditi, and on every series of our Talk Tonic podcast, we've been getting you dependable, trustworthy health facts right from specialist and super specialist. So even on this episode, we'll be covering important health facts on kidney, which every Indian, young or elderly, definitely should be knowing. So just for y'all, we've got India's leading nephrologist, Dr. Bharat Shah, with us today. Welcome, sir. It's an honor to have you here. Thank you so much for being on our podcast.
Thank you, Dr. Aditi, for inviting me to your podcast. And I look forward to giving useful information to people who are listening.
Yes, so let's begin. Sir, there's this notion in India that consuming protein powders can lead to kidney problems. Often people do not want to directly dive into it. But if we see people like Salman Khan, Hrithik Roshan, they are obviously consuming these protein powders for muscle mass. So, sir, what's your take on this?
So we have been given huge reserve. You know that living people donate one of the two kidneys and then they continue to eat the same food. So we have such tremendous reserve that by increasing our protein intake, our kidneys can take care of that higher load of protein intake and nothing will happen to them. So if those who go to the gyms and take more protein to build their muscles, if their kidneys are fine, it is perfectly okay.
So, but then shouldn't there be a particular amount that one should be consuming? Is there a limit to the amount of protein or the kind of protein that should be consumed?
So our usual protein intake is about 1 to 1.2 grams per kilograms per day. And when you take more protein, it may become about 2 grams per kilogram per day, but your kidney is able to take that load. You know that when people take that extra load, their GFR can increase by 50%.
GFR means the glomerular filtration rate, which is basically the capability of the kidney to filter out your blood to produce urine. So if your GFR, the glomerular filtration rate, which is the kidney's capability, is good enough, then it's perfectly all right. Right, sir?
Exactly. And that is what happens when a woman carries a child. During pregnancy, the glomerular filtration rate increases to take care of the kidney function of the baby. In the same way, when you take more proteins, your kidneys can take that extra load and continue to function normally.
Okay. So, but should these people, especially the gym goers or those who want to build their biceps, etc., who are taking these protein powders, should they get regularly checked for their kidney function? So, we do usually a serum creatinine level to check our kidney functions. That's the most basic test that we have. Should they be doing that regularly, young or adults?
That's a very good point, Aditi. Kidney diseases can often be asymptomatic, and people may not know if they have a kidney problem. Recently on World Kidney Day, I had an important message for the people that if you do 3 simple tests, routine urine, serum creatinine, and ultrasound of kidneys, if these are normal, then your kidneys are fine.
Okay, all right, that's good to know, sir. So this kind of checkup can be done annually even for young adults, so I mean, that's okay.
So I would say that for young and healthy people, they need not do it annually. If they do it once and it is fine, and if they've had no intercurrent illness, and if they have no symptoms, then they need not do it annually. If they are very health conscious, they may do it once in 5 years. But if you have some symptoms And one symptom about which I would want to stress is the swelling of the legs. Many people ignore swelling of legs, and secondly, high blood pressure. These two parameters are indicators of possible underlying kidney problem. They should get it definitely done.
Okay. So, what should be a normal creatinine level for a young adult in India, say between the age of 20 to 40? Because I remember you telling me once that, Salman Khan's creatinine could be quite different from another individual of the same age who's quite lean, who doesn't have so much muscle mass. So, what would be the normal creatinine?
So, that's a very good point. You see, level of any substance in the blood will depend upon the rate at which it is generated and the rate at which it is being removed. In case of creatinine, it depends on the muscle mass of a person and the intake of meat in the diet that would generate creatinine, and its removal depends on the kidney function. So supposing if you are a thin, lean person, your creatinine generation will not be as much as that of a person who is highly muscular. And if both people have the same kidney function, the creatinine of a thin, lean person will be low, whereas that of a muscular person will be high. And therefore, the normal range of creatinine, and I'm giving you a range because that will depend on the muscle mass of a person, the dietary habits of a person, will be about 0.5 to 1.1 milligram per deciliter. You can realize that this is a wide range. So for a thin, lean person, the normal creatinine will be 0.5. For a person muscular like Mr. Salman Khan, it will be 1.1. Now, if a thin, lean person whose creatinine should be 0.5 has a creatinine of 1.1, it would mean that 50% of his kidney function is down. So this interpretation is very important. And if you remember the muscularity of a person, the build of a person, then you will be able to interpret creatinine properly.
Oh, that is so interesting to know. So I myself never knew about this. So, since you mentioned that swelling of the feet is one important parameter, who else is at risk of getting kidney problems, especially in India?
It is not a question of India, it is a universal thing. With growing incidence of diabetes and high blood pressure, more and more people are developing kidney disease. And this is because they don't control it well. Diabetes is asymptomatic, high blood pressure is asymptomatic. People feel nothing is happening to me. Why should I check? Why should I take medicines? But studies have clearly shown that if you keep your diabetes and high blood pressure in control, you will not develop these complications. So my sincere advice to all my fellow citizens that if you have diabetes and high blood pressure, please ensure that they are well controlled, and this is only possible if you monitor regularly at home.
So majority of your patients who are coming with kidney problems are diabetics or hypertensives. But what about that population which is non-diabetic, non-hypertensive, which is more commonly getting affected by kidney problems? Which ones are these?
That's another important question. And because kidney disease is asymptomatic, it is important to know about this. The other major cause of kidney disease is what we call autoimmune disease. Now, normally, our immune system does nothing to us. It recognizes our body parts. But when anything foreign enters our body, it will try and attack us. Sometimes our own immune system makes a mistake and thinks our part to be foreign and attacks them. This can happen to the skin, to the joints, to the kidney. And when it affects the kidney, it will cause damage to the filters, which will allow protein to leak. When the protein leaks and the level of protein in your blood goes down, you will develop swelling. So that is why I say that one early indicator of kidney disease, often it may be asymptomatic, is swelling of the legs. Don't ignore this. If you are swelling, do check your kidney function. So that is about autoimmune kidney disease. There are certain conditions where we don't take care of our kidneys. For example, if you are forming kidney stones, if you take care of it, if you prevent them, then your kidneys will not be damaged. What happens is that when you get a kidney stone, they go to the surgeon removes the stone, but they fail to find out why the stones are forming. Once a kidney stone is formed, there's a 50% chance that stone will form again. And sometimes these stones can be silent and keep damaging the kidney. So if you have a stone which is blocking the flow of urine, and if you have no pain, don't think that you don't need anything to be done. You must get that obstruction removed.
Okay.
The other thing is that painkillers are very often abused. You have high blood pressure which gives you headache, and for headache you keep taking painkiller medicines. That damages the kidney. High blood damages the kidney. This act together and damage the kidney. Many people are obese. It affects your joints, particularly the knee joints. And when you get this osteoarthritis, you keep taking painkiller medicines. And when you take too many painkillers for a very long time, it can damage the kidney. Taking it for an occasional headache or occasional pain is not a problem. But taking it every day for years is certainly a problem.
So since you mentioned about painkillers, in India there is a certain section of population who is so scared of taking any medicine, thinking, "Arey, ye liver ya kidney fail kar dega, mat lo," even though they are in pain or even though they are having a problem. So to what extent can a drug actually go on to cause kidney problem? Because if there are people who might require the painkiller for a year also, occasionally of course, but will that harm them even though they are taking it month after month for a year or two, especially the people with uh, cancer patients who have a lot of pain problem? So what can you say about these medicines?
So, if you have a major problem like malignancy and you need pain relief, you must take. But if you have pain, you must try and find out the cause. Why am I getting pain every day? You can't be taking painkiller for headache every day. You can't be taking painkiller for your knee joint pain every day. You must try and find out the cause and treat the primary cause. Now, you brought out a point that many in our country are scared of taking any medicines. I hope that is really true. Many people resort to alternative therapy, thinking that this alternative therapy has no side effects. I want everyone to understand that there is nothing in this world which has only beneficial effects and no side effects. So just as allopathic medicines have side effects, Ayurvedic, homeopathy, Unani, all medicines will have side effects. The advantage with allopathic medicine is that here we know what the side effects are. So we can be careful and watchful. But when we take alternative therapy, we don't know what its content is. We don't know what its effects are. We don't know what its side effects are. My suggestion to everyone is don't touch anything, any medicine about which you do not know what its content is, what its effects are, what its side effects are.
Yes, sir. This just reminds me actually because during our residency, we used to have, with due respect to both the other pathies, homeopathy, Ayurvedic, I think they are wonderful in their own might. But during our residency, we have seen patients taking these unchecked medicines, probably from quacks, and a lot of them used to land up in the dialysis room. So I feel when these heavy metals or when the contents are not known, when the exact dose is not known, or they are taken from unreliable sources, it can definitely cause more harm than not. So what are those few myths that you would like to bust and the Indians especially need to know on dialysis and kidney transplant?
Again, a very important practical question. Many people feel that even if their kidneys are failing slowly and steadily, they will be able to avoid dialysis. Now, once the kidneys fail beyond a certain extent, like let's say kidney function is less than 5% of normal, dialysis becomes mandatory for survival. And unfortunately, with the wrong myth that they can continue on medicines, they delay it so much that one day they'll end up in the hospital in the ICU setting. If only they were to understand and plan their treatment properly, 6 months before we feel that dialysis may be required, it is a good idea to make a small surgery on the hand called arteriovenous fistula, which is necessary for dialysis. If you don't have that and you need emergency dialysis, you have to put a catheter in the neck, which carries some risk of infection if you keep for a longer time. It is an unnecessary procedure if you have planned well. So I would recommend that if you are observing that your kidney function is slowly and steadily going down, if the doctor advises you, make your AV fistula. For those who can go for transplant, and if they have a family donor, they can make a fistula, but when it becomes necessary, they can go directly for kidney transplant. In that way, they do not waste time, energy, and money on dialysis. It is a very smooth transition because transplant is a far superior treatment than dialysis. Dialysis does only 10% of kidney function, the excretory function of the kidney. It does not make blood for you, it does not make your bones stronger, it does not keep your blood pressure well controlled, so all other problems persist. If you don't have transplant as an option, this is your only option and you have to accept it. But if transplant is an option, you must go for transplant. You can return to near normal quality of life. My longest surviving is a patient who has had a transplant in 1990 or 1991, and she is completely fit after having received kidney from her mother. So one must go for transplant, and particularly young people must go for kidney transplant. Now, you were asking about myths about transplant. Many people feel that if they do a transplant, they will have to remain in isolation for years. That is not true. Transplant is to return back to normal life. So after a few weeks, you should go back to work and you should do everything that you were doing before. Only recommendation we make is that if you are in a very crowded area, better to wear a mask. No big deal. When you are in your office, when you are not in a crowded area, you are like normal person. Mix with people, mix with friends, go out for lunch, dinner, lead a completely normal life.
So, how does the kidney get damaged in the first place, whether it's a diabetic or a non-diabetic? What exactly happens?
So there are two ways in which kidney can get damaged. The kidney can get damaged suddenly. For example, in a situation where you get gastroenteritis, loose motions, vomiting, dehydration, low blood pressure. You correct that problem and that kidney will recover. This is acute kidney injury. Similarly, you get a heart attack, your blood pressure drops transiently, and then you stabilize it. The kidney gets transiently damaged, but once you correct the blood pressure, it will completely recover. I mentioned about kidney stone causes a block. You remove the block to the flow of urine, that kidney will recover. You get kidney infection, you use appropriate antibiotics, and it will recover. So sudden kidney injury can almost completely recover, even if it is a severe kidney injury.
Oh.
It is possible that because of sudden severe kidney injury, a person goes on dialysis. Once the kidney recovers, the dialysis will stop. This is called as acute kidney injury.
So what you're trying to say is that it's not necessary for a person on dialysis to always stay on dialysis.
Exactly. Now, this is what many cases with permanent kidney failure or end-stage kidney disease do not realize. They sometimes come and tell me that my neighbor had severe kidney failure, he was on dialysis, and after a session of 5 or 6 dialysis, he improved. So why can't that happen to me? The main difference is that his neighbor had an acute kidney injury, whereas this gentleman has a chronic kidney disease. A chronic kidney disease is permanent. It cannot recover. But if you make proper treatment, if you take proper treatment, you can halt the progress or slow the progress. Now, why is kidney disease in some cases chronic? Because the cause is something which you cannot eradicate. If you have diabetes and you don't control well, what will happen? It will keep on affecting the kidney, and therefore you will develop a progressive kidney disease. If you have high blood pressure and don't control it well, it will cause progressive kidney injury. But if you have a cause which you can keep in good control, you can halt the progression of kidney disease. I had a patient with high blood pressure and creatinine of about 2 to 2.5 milligrams per deciliter, which means kidney function which was 40%. I got his blood pressure well controlled. He continued another 20 years at the same level of kidney function.
Oh.
So I tell people, don't resort to unnecessary therapy just because your creatinine is not normal. You don't have to do that. Just take care of the problem and that will take care of your kidney function. This patient, when he needs dialysis, he will need it lifelong unless he goes for kidney transplant. He cannot compare himself with a person who had acute kidney injury and required dialysis, because acute kidney injury will improve, but chronic kidney disease or end-stage kidney disease, which results from chronic kidney disease, can never improve.
Sir, in your career of 30, 40 years as a nephrologist, I would want to know what was the most interesting case that you have ever come across?
So I would tell you about a case about which I feel very happy. This was in late 90s when the deceased donor transplant program had just started.
The disease
And
donor
transplant program.
what was it, sir?
A deceased donor transplant program means someone donating kidney after death.
After death.
Before 1994, before the Transplant Act came into picture, it was all living donor kidney transplant in our country. But after the Transplant Act, which made brainstem death as death, deceased donor transplant program started in our country.
Okay. So after brainstem death is declared,
Yes.
one can donate.
Yes, yes. So that is called as deceased donor transplant. So there was a patient at Jaslok Hospital. I don't know whether I should use the name. There was a patient in another hospital, 70-year-old female. She had died of brain hemorrhage. Her kidney function was good. Creatinine was 0.6 milligrams per deciliter. But everyone was worried about age. That because of 70 years age, will that kidney be fine? It can be fine. If your creatinine is fine, and if you are well built and you have creatinine of 0.6, that means your kidneys are fine. So all the hospitals in the city, including the hospital where this donor was, refused to accept the kidney. And this is the time when we reasoned out that if the kidneys are working well in that person, why should they not work well in a person who needs a transplant? So we accepted the kidneys and we transplanted both kidneys in a young man. And I am so thankful to that man because he had that faith in me. He said, "Doctor, if you are okay, then I'm okay to go for transplant." And we did a transplant for him, and those kidneys worked all through his life until he died eventually of a heart attack, but his kidneys worked all through his life. It makes me feel very happy for doing transplant from that deceased donor.
Thank you so much, sir. I think we have had a fantastic chat on kidney health, which is so important for young Indians to know especially. Thank you so much, sir, for being on the podcast.
So thank you, Aditi, for this wonderful opportunity. I think what you are doing is a great job. You are educating society and making them aware. And that itself is so important in preventing many medical problems. I would certainly ask all my friends, family to like your podcast and to view that and create awareness in the society about how to prevent several medical problems.